90% of the wounded returned to duty. 90%. In previous wars, such a figure seemed impossible. But Soviet doctors achieved the impossible. Nikolai Burdenko developed methods that saved the lives of those wounded in the head. Alexander Vishnevsky invented an ointment that prevented gangrene. Millions of female medics carried the wounded from the battlefield under fire. The system of staged treatment worked like clockwork. Antibiotics defeated infections. Blood transfusions saved people from shock. Every wounded soldier had a chance to survive and return to battle. This is a story of medicine's triumph over death. A story of doctors who were called doctors of death, but who were actually the saviors of millions of lives. If you are interested in the history of the Great Patriotic War, subscribe to the channel and like the video. And in the comments, let's discuss the question: can the medical service be considered one of the main factors in victory, on a par with weapons and strategy? After all, without doctors who saved the wounded and returned them to duty, the army would not have been able to replenish its losses. Write your opinion. On June 22, 1941, the Soviet Union was hit by an unprecedented blow. The Wehrmacht threw 3.5 million soldiers, thousands of tanks, and aircraft against the country. The war came suddenly and brought with it not only death, but also such a number of wounded that no medical system in the world could have imagined. Already in the first weeks of fighting, Soviet hospitals were overflowing. Tens of thousands of wounded were counted every day. Bullet and shrapnel wounds, burns, concussions, frostbite. The entire spectrum of war injuries descended on doctors at once. Soviet medicine was faced with a task that seemed impossible to solve. In World War I, no more than 30% of the seriously wounded survived. The rest died from blood loss, shock, infections, and gangrene. The medicine of those years had no effective means of combating these complications. There were no antibiotics, pain relief methods were primitive, and blood transfusions remained an experimental procedure. A wounded soldier was more likely not to return to duty than to survive and continue fighting. But the Great Patriotic War changed these statistics dramatically. By the end of the war, 90% of wounded Red Army soldiers were returning to duty. 90%! This meant that out of every 10 wounded soldiers, 9 were able to take up arms again. This figure was unprecedented in world military history. Even the enemy acknowledged that Soviet military medicine had achieved results that German doctors could only dream of. What was behind these figures? What kind of people and methods made it possible to turn military medicine into a system for saving lives on a massive scale? Behind the success of Soviet medics were years of training, scientific discoveries, and the personalities of outstanding doctors who turned the treatment of the wounded into an exact science. They were not just surgeons operating in quiet hospital walls. They were scientists who worked under bombardment, created new techniques right on the front lines, and risked their lives to save soldiers. Among them were names that have gone down in the history of medicine. Nikolai Burdenko was the founder of Soviet neurosurgery and the chief surgeon of the Red Army. Alexander Vasilyevich Vishnevsky, creator of local anesthesia methods and the famous ointment that saved thousands of limbs from amputation. But success was not only due to the genius of individual doctors. Soviet medicine created a unique system of staged treatment for the wounded. From the medic on the battlefield to the surgeon in the rear hospital, each link in this chain worked smoothly and effectively. Medical battalions, field hospitals, medical trains and aircraft, evacuation points and rear clinics all became part of a single rescue mechanism. A wounded soldier received help within the first few minutes after being wounded, then was taken to the next stage, where treatment continued, and so on until full recovery. This system was thought out to the smallest detail and tested in the most brutal conditions. The war was a test not only for soldiers, but also for doctors. They had to operate in dugouts and tents, work for days without sleep, and make decisions in seconds when a person's life depended on their actions. They saw injuries that seemed incompatible with life and still fought for everyone. The doctors of the Great Patriotic War did not just treat the wounded. They returned the soldiers to the front lines, giving them a second chance to defend their homeland. It was thanks to their work that the Red Army was able to replenish its losses and continue its offensive even after the bloodiest battles. How were such results achieved? What discoveries did Soviet doctors make? What was everyday life like in military hospitals? And what happened on the operating tables amid the roar of artillery? The history of Soviet military medicine is a story of the triumph of human intellect and compassion over the destructive power of war. It is a story about people who saved lives when death seemed inevitable. Nikolai Nilovich Burdenko was born on May 22, 1876, in the village of Kamenka in the Penza province. His father was the manager of a small estate, and his mother was a homemaker. The family lived modestly but attached great importance to education. Little Nikolai grew up to be an inquisitive boy, devouring books about travel and discovery. Even as a young man, he dreamed of becoming a doctor. The path to this dream was not easy. After graduating from the Penza Gymnasium, Burdenko enrolled in the medical faculty of Tomsk University. It was there, in the distant Siberian land, that he began his career as a doctor and scientist. In 1903, Burdenko received his medical degree and went to work at a district hospital. District medicine in those years required doctors to be versatile, to treat all diseases, from colds to serious injuries. The young doctor, Burdenko performed operations, delivered babies, and fought epidemics. This school gave him invaluable practical experience. He saw the real suffering of people and understood that medicine should not just alleviate pain, but find radical ways to cure it. He was particularly attracted to surgery. The opportunity to repair with his own hands what had been broken by illness or injury seemed to him to be the highest manifestation of the art of medicine. The Russo-Japanese War of 1904-1905 was Burdenko's first serious test. He volunteered to go to the front as a military surgeon. In the field hospitals of Manchuria, the 28-year-old doctor encountered a massive influx of wounded soldiers for the first time. Bullet and shrapnel wounds, burns, infections, all of this required quick decisions and confident action. Burdenko worked 20 hours a day, operated by the light of kerosene lamps, and saw people die who could have been saved with more advanced treatment methods. This war taught him the most important lesson. In military medicine, it is not only the technique of the operation that is important, but also the organization of assistance. After the war, Burdenko continued his scientific career. He defended his doctoral dissertation and became a professor of surgery. But he was particularly interested in a field that was just emerging in those years: brain and spinal cord surgery. Neurosurgery was considered incredibly risky. The brain remained terra incognita for doctors at the beginning of the 20th century. Operations on it often ended in the death of the patient. But Burdenko believed that with the right approach, even this most complex field could be mastered. He studied the anatomy of the brain, experimented on animals, and developed new surgical instruments. Gradually, his name became known in the medical world. By the early 1930s, Nikolai Nilovich Burdenko was a recognized authority in the field of neurosurgery. He headed the department at the Moscow Medical Institute, created the first neurosurgical clinic in the USSR, and trained a whole school of students. His methods of brain surgery made it possible to save patients even with the most severe injuries and tumors. Burdenko developed techniques for removing brain tumors, methods for stopping intracranial bleeding, and ways to combat brain edema. Each of his operations was a small miracle, a demonstration of what medical science is capable of. But the main challenges were still ahead. When the Great Patriotic War began, Nikolai Nilovich Burdenko was 65 years old, an age when many people think about retirement. But for him, the war became a time of great exertion. In July 1941, he was appointed Chief Surgeon of the Red Army. The responsibility for the entire medical support system at the front fell on his shoulders. Millions of wounded, thousands of hospitals, tens of thousands of doctors and nurses. All of this had to be managed. Burdenko understood that the outcome of the war depended on how effectively military medicine would work. A wounded soldier should not be a loss to the army. He must be healed and return to duty. Burdenko personally visited the front, visited field hospitals, and observed the work of surgeons. He saw all the problems from the inside: the shortage of medicines and instruments, the overload of doctors, the difficulties of evacuating the wounded. And he found solutions. Under his leadership, a system of staged treatment was created, which we will discuss in detail later. He insisted on rapid initial treatment of wounds, mandatory blood transfusions for major blood loss, and the use of the latest drugs. But most importantly, he demanded maximum dedication from every military doctor. Burdenko himself set an example, continuing to operate even in his old age. His operations on soldiers with head injuries saved hundreds of lives. How did this rural boy from the Penza province become a legend of Soviet medicine? What enabled him to create techniques that revolutionized neurosurgery? And what role did Burdenko play in achieving that very 90% recovery rate for the wounded? Head injuries were considered the most dangerous and often fatal. A bullet or shrapnel piercing the skull damaged the brain, the organ on which all human life depends. In World War I, such wounded soldiers had almost no chance of survival. Even if a soldier was taken to the hospital in time, surgeons rarely dared to operate. The risk was too great. Infection, bleeding, damage to vital areas of the brain, all this made the operation a lottery. The mortality rate for traumatic brain injuries reached 80%. Most doctors at the time believed that it was better not to touch the brain at all than to try to operate on it and kill the patient on the operating table. Nikolai Burdenko thought differently. His many years of experience in neurosurgery showed that the brain could and should be operated on. But this required special knowledge and techniques. When the war began, Burdenko was faced with a flood of head injuries. In the first year of the war alone, there were more than 100,000 such cases. Every person with a head injury could become disabled or die. Burdenko realized that a system was needed that would allow such soldiers to be saved en masse, rather than on an exceptional basis. He began to develop protocols for the treatment of traumatic brain injuries that could be used by surgeons across the front, even those who did not have special training in neurosurgery. Burdenko's main principle was early surgical treatment of the wound. He insisted that a person with a head injury should be operated on as quickly as possible, within the first few hours after the injury. Why was this so important? The fact is that an open skull wound becomes a gateway for infection. Bone fragments, pieces of tissue, blood clots, all of this creates an ideal environment for the development of purulent inflammation. And brain infection, meningitis or encephalitis, kills a person in a matter of days. Early surgery allowed all foreign bodies to be removed, the wound to be washed, bleeding to be stopped, and the skull defect to be closed. This dramatically reduced the risk of infection and gave the brain a chance to recover. Burdenko developed a special technique for trepanation of the skull in field conditions. Trepanation is the opening of the skull to access the brain. The operation is complex and dangerous even in peacetime, and here it had to be performed in dugouts and tents, in poor lighting, under the roar of cannon fire. Burdenko created a set of special instruments that allowed the surgeon to quickly and accurately remove the damaged bone without traumatizing the brain. He taught military surgeons the technique of the operation, showing them how to determine the boundaries of the damage, how to stop bleeding from the cerebral vessels, and how to suture the dura mater. Each of his manuals was written with extreme clarity and accompanied by illustrations. But surgical technique is only half the battle. The other half is dealing with the consequences of the injury. The main enemy of a head injury victim was brain edema. The brain, enclosed in a rigid skull, cannot expand. If swelling begins after an injury, the brain is compressed, its structures are displaced, and blood circulation is disrupted. This leads to coma and death. Burdenko developed methods to combat swelling, dehydration therapy, lumbar punctures to reduce intracranial pressure, and the use of hypertonic solutions. These measures saved thousands of lives. Wounded people who would have died from brain edema survived and gradually recovered. Another problem was gunshot wounds with damage to large blood vessels in the brain. Bleeding inside the skull is deadly. Blood accumulates, forming a hematoma that compresses the brain. The surgeon has only a few hours to find the source of the bleeding and stop it. Burdenko was a master of the technique of stopping cerebral hemorrhages. He used special clips for blood vessels, hemostatic sponges, and coagulation methods. Under his leadership, thousands of operations were performed to remove intracranial hematomas. Many of these operations seemed hopeless, but Burdenko achieved success where others had given up. The results of Burdenko and his school's work exceeded all expectations. By the end of the war, the mortality rate for traumatic brain injuries had dropped to 35 to 40%. This meant that 6 out of 10 soldiers wounded in the head survived. For military medicine at that time, this was a fantastic result. Moreover, many of the survivors returned to duty. Burdenko proved that a head injury was not a death sentence. With proper treatment, the brain is capable of recovering, compensating for damage, and restoring a person's ability to live and function. His methods formed the basis of modern military neurosurgery. But was it only Burdenko's achievement? Or did other outstanding doctors work alongside him, contributing to the rescue of the wounded? And what other revolutionary methods were used in Soviet military hospitals? Alexander Vasilyevich Vishnevsky was born on August 27, 1874, in Kazan. His father was a pharmacist and owned a pharmacy. From childhood, Alexander saw how people came for medicine, how his father prepared complex prescriptions, mixed tinctures and powders. This atmosphere of healing shaped his future calling. After graduating from high school, Vishnevsky entered the medical faculty of Kazan University. He was a brilliant student, particularly interested in surgery and anatomy. Even as a student, he understood that the surgery of the future should not only be technically perfect, but also as gentle as possible on the patient's body. After graduating, Vishnevsky worked as a district doctor, then became an assistant in the Department of Surgery. He was interested in a problem that tormented all surgeons of that time: the problem of pain relief. At the end of the 19th century, operations were performed either under general anesthesia or without anesthesia at all. General anesthesia was dangerous. The patient could die from an overdose, respiratory arrest, or an allergic reaction. In addition, anesthesia had serious side effects: nausea, dizziness, and weakness for several days. Vishnevsky wondered, is it possible to anesthetize only the area being operated on without putting the patient into an unconscious state? The idea of local anesthesia had been around for a long time. Back in the late 19th century, cocaine and novocaine were discovered, substances capable of blocking the transmission of pain impulses along the nerves. But the practical application of these drugs was limited. Doctors did not know the exact dosages, did not understand the mechanism of action, and feared complications. Vishnevsky began to systematically study local anesthesia. He experimented on animals, then performed operations on humans, carefully recording all the results. Gradually, he developed his own method, the creeping infiltrate method, which would later be called the Vishnevsky-Novocaine block. The essence of the method was simple and ingenious at the same time. Vishnevsky used a weak solution of novocaine, only 0.5%. He injected this solution under the skin and into the tissues layer by layer, creating a kind of cushion of anesthetic. The solution spread through the tissues, penetrated the nerve endings, and blocked the transmission of pain. At the same time, the patient remained conscious, could talk to the surgeon, and control their sensations. The surgical trauma was minimal because the tissues were spread apart by the liquid rather than being cut roughly. Recovery after such operations was much faster. By the 1930s, Vishnevsky's method had gained wide recognition. Alexander Vasilyevich became a professor, headed the Department of Surgery at the Moscow Medical Institute, and published fundamental works on local anesthesia. His students worked throughout the country, but the main test of the method was yet to come. When the Great Patriotic War began, novocaine blockade became one of the main tools of military surgeons. Why? Because general anesthesia was often impossible at the front. There was a shortage of anesthesia machines, ether, and qualified anesthesiologists. Novocaine, on the other hand, was accessible, easy to use, and safe. Vishnevsky personally trained military surgeons in his method. He explained that Novocaine block was not just pain relief, it was also a therapeutic procedure. Novocaine relieves vascular spasms, improves blood circulation in tissues, and prevents the development of shock. A wounded soldier who received a Novocaine block immediately after being wounded had a much better chance of survival. The block was used for all types of injuries: bone fractures, abdominal wounds, and extensive burns. It saved soldiers from the pain shock that killed them before they could be transported to the hospital. The administration of Novocaine became the first aid that even a medic could provide. But Vishnevsky did not stop at the block. He understood that many wounded soldiers died not from the wound itself, but from its consequences: suppuration, gangrene, and blood poisoning. A simple and effective remedy for treating wounds had to be found. And he found it. Vishnevsky created an ointment that was named after him and became a legend in military medicine. Vishnevsky's ointment has 3 components: tar, xeroform, and castor oil. Simple, cheap, and incredibly effective. But how did it work? What was this legendary ointment? And how did it save the wounded from gangrene and amputation? What other discoveries by Vishnevsky helped Soviet doctors defeat death? Vishnevsky's ointment appeared in 1927. By that time, Alexander Vasilyevich was already a well-known surgeon and was looking for a way to treat purulent wounds. The problem of wound suppuration was acute. Any wound, especially a contaminated one, became a gateway for infection. Bacteria penetrated the tissues, began to multiply, and caused purulent inflammation. If the pus accumulated deep inside, an abscess or phlegmon would form, dangerous conditions requiring immediate surgery. But even after the abscess was opened, the wound did not heal for a long time and continued to fester. In the most severe cases, gas gangrene developed, a fatal complication in which it was almost impossible to save the limb. Existing methods of treating purulent wounds were ineffective. Wounds were washed with antiseptics and bandaged with various solutions, but this often did not help. Vishnevsky thought differently. He believed that the wound should not dry out, but remain moist. A dry crust on the surface of the wound prevents the outflow of pus and creates conditions for bacteria to multiply deep inside. An ointment was needed that would keep the wound moist, ensure the outflow of pus, destroy bacteria, and stimulate healing. And he created such an ointment based on 3 simple ingredients. Birch tar is an ancient folk remedy. It was used to treat skin diseases, burns, and frostbite. Tar has a powerful antiseptic effect, kills bacteria, and reduces inflammation. But it has a pungent odor and irritates the skin. Vishnevsky added castor oil, which softened the effect of the tar and made the ointment gentler. The third ingredient was xeroform, a powder with antiseptic properties that dried the wound and enhanced the antimicrobial effect. The proportions were chosen perfectly: 3 parts tar, 3 parts xeroform, and 94 parts castor oil. The result was a dark ointment with a characteristic tar smell. The first tests of the ointment exceeded all expectations. Vishnevsky applied ointment bandages to purulent wounds, and after a few days the inflammation subsided. The pus stopped oozing, and the wound began to clear up. The ointment literally drew out the pus, creating conditions for healing. At the same time, It did not damage the tissue, did not cause pain, and did not require frequent bandage changes. Patients tolerated the treatment easily. The ointment began to be used for boils, abscesses, trophic ulcers, burns, and frostbite. It showed excellent results everywhere. By the beginning of the Great Patriotic War, Vishnevsky's ointment was well known to Soviet doctors. The war created ideal conditions for the use of the ointment. The wounded often had contaminated wounds. Soil, scraps of clothing, and shrapnel got into the wound along with the bullet or shell. Suppuration began. If the wound was not treated properly, gangrene developed. In World War I, such wounded soldiers were simply amputated. Their limbs were cut off to save their lives. But amputation made a person disabled. Vishnevsky proposed a different tactic: thorough surgical treatment of the wound with removal of all contaminants, followed by the application of a bandage with his ointment. The ointment prevented the development of infection, helped clean the wound, and accelerated healing. The results were remarkable. The number of amputations for gunshot wounds to the limbs decreased several times over. Wounded soldiers who would have been considered hopeless in other armies recovered and returned to duty. Vishnevsky's ointment became a mandatory component of every military first aid kit. Millions of packages were produced, and it was in every field hospital and every medical battalion. Medics applied ointment bandages directly on the battlefield, stopping the development of infection in the first hours after injury. Surgeons used the ointment after operations to prevent the stitches from becoming infected. It is impossible to calculate how many people this simple ointment saved. But the ointment had another use. Vishnevsky discovered that if an ointment dressing was applied to the area of inflammation before an abscess formed, suppuration could be prevented altogether. The ointment reduced inflammation and dissolved the infiltrate, preventing it from turning into an abscess. It was a revolutionary discovery. The method began to be used in the treatment of panorrhitiums, mastitis, lymphadenitis, all conditions that threaten to turn into purulent inflammation. In many cases, it was possible to avoid surgery and get by with conservative treatment. For wartime, when every operation was a risk, this was of great importance. Vishnevsky did not stop at ointments. He continued to improve wound treatment methods, developed new surgical techniques, and trained military doctors. But his main contribution to victory was the thousands of limbs he saved. The soldiers who, thanks to the ointment, avoided amputation and disability. A simple remedy consisting of 3 components proved to be a powerful weapon against one of the main enemies of the wounded: wound infection. And this weapon was available to every military doctor, worked in all conditions, and did not require complex equipment. How was the system of assistance to the wounded organized from the battlefield to the rear hospital? What stages did each wounded soldier go through? And who provided this system? The system of staged treatment of the wounded was developed during the Civil War, but it was during the Great Patriotic War that it reached perfection. The principle was simple. The wounded were not treated in one place until they were fully recovered. They were treated in stages, with each stage focusing only on what was necessary to save their lives and prepare them for the next stage. This approach made it possible to quickly free up space in frontline hospitals for new casualties, while ensuring that everyone received the necessary care. From the first bandaging on the battlefield to surgery in a specialized hospital deep in the rear, Each stage was carefully thought out and organized. The first stage was the battlefield. Here, assistance was provided by medics and medical instructors. They had no medical education, only brief training, but they knew the most important things: how to stop bleeding, apply a bandage, give painkillers, and carry the wounded off the battlefield. Medics worked under enemy fire, risking their lives. They crawled to the wounded, bandaged them right in shell craters, and dragged them to the medical station. Over the years of the war, medics saved millions of lives. Without their work, no medical system would have functioned. A wounded soldier left on the battlefield would have died from blood loss in a matter of minutes. The second stage was the battalion medical station. It was located a few hundred meters from the front line, in a dugout or bunker. A military paramedic worked here with several medics. At this stage, the wounded were given first aid. Bleeding was stopped with a tourniquet, a Novocaine block was administered, transport splints were applied for fractures, and tetanus serum was injected. The main task was to prevent shock and prepare the wounded for evacuation. Here, the wounded were also sorted. The seriously wounded were sent to the hospital immediately, while the lightly wounded were sent after receiving first aid. The time spent at this stage was no more than 2 hours. The third stage was the regimental medical station. It was located 3 to 5 kilometers from the front line. Here, a doctor and medical staff were already working. At this stage, anti-shock measures were carried out. Blood and blood substitutes were transfused, heart medications were administered, and the wounded were warmed. They performed control dressings and checked the correctness of tourniquets and splints. If the tourniquet was too tight and the limb began to die, it was loosened and the bleeding was stopped by other means. Here, a more thorough sorting was carried out to determine which hospital each wounded person should be evacuated to. This stage took 4 to 6 hours. The fourth stage was the division's medical battalion. This was a real field hospital with a sterile operating room. Here, they performed emergency operations. They stopped internal bleeding, sutured wounds, removed crushed tissue, and amputated limbs in cases of hopeless damage. Qualified surgeons worked here. They had everything they needed for surgery: instruments, anesthesia, bandages, and medicines. The operation lasted an hour and a half, and only the most necessary procedures were performed to save the patient's life. Complex interventions were postponed to the next stages. After the operation, the wounded patient rested for several hours, received food and painkillers, and was then evacuated further. The fifth stage was the Army's mobile field hospital. It was located 20 to 30 kilometers from the front, usually in a good building, a school, club, or former sanatorium. Here there were real wards, operating rooms with electricity, X-ray machines, and a laboratory. Experienced surgeons of various specialties worked here. At this stage, more complex operations were performed. Damaged vessels and nerves were repaired, shrapnel was removed from internal organs, and bone plastic surgery was performed. The wounded remained here for several days or weeks, depending on the severity of their condition. Then they were evacuated either to a rear hospital or, if they were recovering, sent to their unit. The sixth stage was deep rear hospitals. These were inpatient hospitals in rear cities, equipped with the latest technology. Here, the seriously wounded who required long-term rehabilitation were treated. Repeat operations, prosthetics, and restorative treatment were performed. The country's best specialists worked here. Many wounded soldiers spent months in such hospitals. But the task remained the same: to return the soldier to duty. And the doctors did everything possible to achieve this. They used the latest methods of physiotherapy, therapeutic gymnastics, and sanatorium treatment. As a result, thousands of soldiers returned to their units. The system worked like a well-oiled machine. The wounded made their way from the battlefield to the rear hospital in a matter of days. At each stage, they received exactly the help they needed at that moment. No unnecessary procedures, no delays. Evacuation was continuous, by ambulances, trains, and planes. The frontline medical service worked around the clock. Even during the most difficult periods of the war, the system never failed. Field surgical hospitals were the heart of military medicine. It was here that operations were performed that saved the lives of thousands of wounded soldiers. A field surgical hospital was a mobile facility that could be set up in a few hours anywhere. Usually, the hospital was located in surviving buildings, schools, clubs, rural hospitals. But if there were no suitable buildings, tents were set up. The main requirement was proximity to the front line and the ability to evacuate quickly in case of retreat or attack. A typical field hospital had 2 or 3 operating rooms, a dressing room, wards for the wounded, a pharmacy, and a sterilization room. The staff consisted of 30 to 40 people: surgeons, anesthesiologists, operating room nurses, and orderlies. The equipment was minimal but sufficient: surgical instruments, an anesthesia machine, a sterilizer, dressing materials, and medicines. Electricity was often unavailable, so they worked using a generator or kerosene lamps. Heating was provided by potbelly stoves. In winter, the operating room was cold, and surgeons operated in quilted jackets, warming their hands before each operation. Work continued around the clock. When the battle began, dozens of wounded soldiers were brought in. The triage team examined each one and determined the order of operations. The first to be operated on were those who could die in the next few hours: the wounded with ongoing bleeding, internal organ damage, or open pneumothorax. Operations followed one after another, with surgeons working 12 to 16 hours without a break. They were so exhausted that they could barely stand, but they continued to operate. Every life saved gave them the strength to continue. Operations in the field were different from those in peacetime. There was no time. They had to operate quickly. The surgeon did only what was absolutely necessary: stopped the bleeding, removed non-viable tissue, drained the wound, and applied temporary sutures. Plastic surgery and the restoration of nerves and tendons were postponed to later stages. The main thing was to save lives and prepare the wounded for evacuation. Many operations were performed under local anesthesia using the Vishnevsky method. This saved time and reduced the risk to the wounded. It was especially difficult for surgeons operating on patients with abdominal injuries. Such injuries were considered the most dangerous. A bullet or shrapnel damaged the intestines, stomach, liver, and spleen. Internal bleeding began, and peritonitis developed. Without surgery, the wounded would die within a few hours. But surgery on the abdominal organs required time, skill, and sterility. It was extremely difficult to ensure all of this in field conditions. Nevertheless, Soviet surgeons operated on such wounded soldiers and achieved remarkable results. The mortality rate for abdominal wounds decreased from 90% in World War I to 50% in World War II. Field hospitals operated under the constant threat of bombing and shelling. German aviation and artillery did not always comply with international conventions on the protection of medical facilities. Hospitals were bombed, shelled, and burned. Doctors and wounded soldiers died under the rubble. But even under fire, operations did not stop. Surgeons continued to work until the dugout collapsed on them. There are known cases when the operating room was evacuated right during the operation. The wounded were carried on stretchers to a safe place, and the surgeon continued to operate. The heroism of the medics was an everyday occurrence. They did not abandon the wounded under any circumstances. When the enemy broke through to the hospital's location, doctors and orderlies took up arms and defended their patients. There are known cases when hospital staff engaged in combat, giving time to evacuate the wounded. Many medics died, but they saved hundreds of lives. Over the years of the war, 17 military medics were awarded the title of Hero of the Soviet Union. But how many heroes remain unknown? But how was the problem of blood loss, which killed the wounded faster than bullets, solved? What methods of blood transfusion were used at the front? Blood loss was the main cause of death for the wounded in the first hours after injury. A person who lost more than 2 liters of blood went into shock and died, even if the wound itself was not fatal. During World War I, blood transfusions were rare. Blood types were unknown. Blood could not be stored, and complications were feared. Most wounded soldiers with severe blood loss were doomed. But by the beginning of World War II, the situation had changed. Soviet scientists created a blood service that saved millions of lives. Blood transfusion institutes were opened in the USSR back in the 1930s. Here, blood types were studied, preservation methods were developed, and donor blood was prepared. By the beginning of the war, there was a network of blood transfusion stations in the country. When the war broke out, this system began to operate at full capacity. Donor centers were opened in cities. People lined up to donate blood for the front. During the war, Soviet citizens donated more than 5.5 million liters of blood. This blood saved the lives of countless wounded soldiers. But the blood not only had to be collected, it also had to be delivered to the front. This posed a problem. Whole blood can be stored for no more than a week, even in a refrigerator. And the distance from the transfusion station to the frontline hospital could be more than 1,000 kilometers. Scientists found a solution. They developed methods for obtaining dry blood plasma. The plasma was dried in a special way, producing a powder that could be stored for months. At the front, this powder was dissolved in sterile water to produce a liquid that could be transfused to the wounded. Dry plasma became a real lifesaver for field medicine. In addition to plasma, blood substitutes were used, solutions that replenished the volume of lost blood and maintained blood pressure. The most common was saline solution, a solution of table salt in water. It was transfused in large quantities to replenish the volume of fluid in the vessels. Glucose was also used to provide the body with energy. These simple measures made it possible to bring the wounded out of shock, buy time for transport to the hospital, and perform surgery. Many soldiers owe their lives to these solutions. Blood transfusions became a mandatory procedure for serious injuries. Already at the medical station, the wounded were given plasma or blood substitutes. In the field hospital, a blood transfusion was mandatory before surgery. This compensated for blood loss, increased the chances of a successful operation, and helped the body cope with shock. Surgeons said that without blood, it was useless to operate on a seriously wounded soldier. He would still die on the operating table. But with a blood transfusion, even hopeless cases had a chance. Donors were needed for blood transfusions. At the front, recovering wounded soldiers and soldiers from reserve units became donors. Donating blood was considered an honorable thing to do. A person who donated blood received an extra ration and a few days of rest. But most importantly, they knew that they were saving the lives of their comrades. Many hospitals kept donor logs. They recorded who donated blood and to whom it was transfused. There are known cases when a wounded soldier, returning to duty, learned that his blood had saved the life of another soldier. This created a special bond between the frontline soldiers. The Soviet blood service worked so effectively that even the enemy recognized its superiority. In the German army, blood transfusions at the front were rare. German doctors did not have enough donor blood and did not know how to store it in field conditions. Wounded Wehrmacht soldiers died from blood loss, while Soviet wounded survived thanks to transfusions. This was another advantage of the Red Army, along with its superiority in technology and strategy. Blood transfusions became a symbol of unity between the front and the rear. A worker donating blood at a donation center was directly helping a soldier on the front lines. One person's blood could save another's life, turn a doomed man into a survivor, and return a soldier to the ranks. This simple medical procedure had enormous moral significance. But it was not only men in white coats who delivered blood and plasma to the front. Who formed the backbone of the medical service? Who carried the wounded from the battlefield and nursed them in hospitals? Women formed the backbone of the Red Army's medical service. Of the 1 million medical workers at the front, more than 800,000 were women. Nurses, orderlies, doctors, they worked in all links of the medical chain, from the battlefield to the rear hospital. Without them, the system of rescuing the wounded would simply not have existed. These fragile girls, many of whom went to the front straight from school, performed feats every day. They carried the wounded from the battlefield under fire, assisted in operations, nursed the seriously wounded, and replaced doctors who had been killed. Medics were the most numerous and most dangerous link in the medical service. Their task was to carry the wounded from the battlefield. The norm for a medic was to carry 80 wounded per battle. 80! That meant 10 to 15 hours of continuous work under fire. The girl crawled to the wounded soldier, bandaged him, and then dragged him to a shelter or medical station. A wounded soldier weighed 70 to 80 kilograms, plus weapons and equipment. The medic dragged this load on her back through mud, snow, and shell craters. Many could not endure it and collapsed from exhaustion. But they got up and continued. The mortality rate among nurses was terrible. They were not allowed to carry weapons under the laws of war, but the enemy often targeted them. German snipers hunted nurses, knowing that their deaths would demoralize the soldiers. Tens of thousands of medical workers died during the war, most of them women, but others took their place. Girls volunteered to go to the front, completed short courses to become nurses and medical instructors, and were assigned to the active army. Many were not even 20 years old. Nurses worked in hospitals and medical battalions, They assisted surgeons during operations, dressed wounds, cared for the wounded, administered medication, and fed those who could not eat on their own. The work of a nurse required not only professional skills, but also enormous patience and mental strength. They had to calm the dying, support those who had lost a limb, and instill hope in the desperate. Nurses became doctors, sisters, and mothers to the wounded. Their white coats in the smoke-filled dugouts seemed like a symbol of life amid death. Female doctors worked on an equal footing with men. They performed operations, ran hospitals, and headed the medical services of divisions and armies. Many of them were outstanding specialists. Vera Gedroitz, Russia's first female surgeon, worked in an evacuation hospital and saved hundreds of lives. Zinaida Ermolieva created Soviet penicillin, which was used to treat the wounded. Nina Krylova developed methods of reconstructive surgery. Their names have gone down in medical history, but there were thousands of nameless heroines whose contribution to victory cannot be overestimated. The story of Zinaida Tusnolobova-Marchenko is particularly noteworthy. She was a nurse who carried 40 wounded soldiers during a single battle. When she herself was seriously wounded and her hands and feet were frostbitten, doctors amputated all her limbs. The girl was left without arms and legs, but she did not break. After the war, she became a symbol of courage, wrote letters to veterans, and inspired people. Her story shows that the heroism of medics was no less than that of soldiers. They risked their lives to save others, and many paid the ultimate price for it. Wounded soldiers remembered the nurses with particular warmth. Romances blossomed in hospitals, and many frontline soldiers married the nurses who saved their lives after the war. Letters from the front are full of gratitude to these girls. Soldiers wrote, "The nurse was an angel to us. Her smile gave us the strength to live. Her hands brought us back to life." And that was true. Without female medics, Soviet military medicine would not have achieved its results. But saving the wounded on the operating table is only half the battle. How were the wounded transported from the front lines to the hospitals? What path did each wounded soldier take? The evacuation of the wounded was an extremely difficult logistical task. During the war, the Soviet medical service evacuated more than 22 million wounded and sick people. This meant the continuous movement of medical trains, cars, and planes. The wounded had to be transported quickly, but carefully, so as not to worsen their condition. The slightest delay could lead to complications. Shaking during transport could cause bleeding or displacement of fractures. The cold led to frostbite and pneumonia. All this required special transportation arrangements. Medics carried the wounded from the battlefield to the battalion medical station on stretchers or by dragging them. The distance was not great, only a few hundred meters, but in battle it could take hours. From the battalion medical station to the regimental medical station, they used medical carts, ordinary carts with straw. During the muddy season and in winter, the carts got stuck in the mud and snow. Then more horses were harnessed, or they were pushed by hand. From the regimental medical station, the wounded were transported by car. GAZ and ZIS ambulances were equipped with stretcher mounts and had soft suspension. Ambulance trains became the main means of evacuation to the deep rear. These were specially equipped trains with hospital cars, operating rooms, pharmacies, and kitchens. One train could accommodate up to 1,000 wounded. The trains moved slowly, stopping at stations to examine the wounded, change dressings, and feed them. Doctors and nurses traveled with the wounded, providing assistance along the way. Many operations were performed right on the moving train. The journey from the front line to the Urals or Siberia took a week or two. Aircraft were used to evacuate the most seriously wounded when every hour counted. An airplane could transport a wounded soldier from a frontline hospital to a specialized clinic in the rear in a matter of hours. This was especially important for head, chest, and abdominal injuries. WWII and Douglas transport planes, converted for medical use, were used for evacuation. Stretchers and medical equipment were placed inside. A doctor and nurse accompanied the wounded. During the war, the Air Force evacuated more than 1 million wounded. In winter, the cold posed a particular problem. Wounded soldiers who were transported in open vehicles or carts suffered frostbite on top of their injuries. Many died from hypothermia. Medics wrapped the wounded in everything they had: blankets, greatcoats, and quilted jackets. But this was often not enough. Then they came up with special insulated covers for stretchers and used hot water bottles. In medical trains, the stoves were heated more than usual. All this helped to save lives, but the losses from the cold were still significant. During the evacuation, the order of priority was strictly observed. First, those who needed urgent specialized care were sent to neurosurgeons for head injuries, to traumatologists for fractures, and to burn centers for burns. Then, the seriously wounded who required long-term treatment were evacuated. The lightly wounded remained in frontline hospitals. Often they returned to duty directly from there, without having time to go to the rear. This system allowed the medical service to be used as effectively as possible. The evacuation worked continuously. Even during the most difficult days of the retreat in 1941-1942, medics did not abandon the wounded. Hospitals were evacuated last, after the military units. Doctors remained with the wounded until the end. There are known cases when hospital staff were surrounded together with the wounded. Then they organized a defense, broke through to their own lines, or went into the partisans. The main thing was not to leave the wounded behind. How did medics fight infections, which in past wars killed more soldiers than bullets? Infection was the main enemy of the wounded after blood loss. Even the most careful surgery did not guarantee recovery if bacteria entered the wound. Suppuration, sepsis, and gas gangrene killed thousands of soldiers. In World War I, more soldiers died from wound infections than from their wounds themselves. By the beginning of the Great Patriotic War, the situation had changed. Medicine had acquired a new weapon: antibacterial drugs. These substances could kill disease-causing bacteria inside the body, something doctors had dreamed of for centuries. The first antibacterial agents were sulfonylamides. They were discovered in the 1930s. The most famous drug was streptocide. It was a white powder that was sprinkled into wounds or taken internally in tablets. Streptocide suppressed the growth of streptococci and staphylococci, the main causative agents of wound infections. The use of streptocide sharply reduced mortality from blood poisoning. Every medic had bags of streptocide. When someone got hurt, they'd sprinkle the powder on the wound right away to protect it from infection in the first few hours. But penicillin was the real game changer. It's an antibiotic that was discovered by an English guy named Fleming in 1928. At the beginning of the war, penicillin was only just beginning to be produced in England and the United States. Soviet scientists learned about the miracle drug and began work on creating their own penicillin. Zinaida Ermolieva, an outstanding microbiologist, isolated a Soviet strain of penicillin from mold in 1942. Her drug was named crustocin. It turned out to be even more effective than the imported one. Penicillin production was established in 1943. At first, there was not much of the drug, and it was given only to the seriously wounded. But gradually, production increased. By 1944, penicillin was widely used. The wounded with purulent complications were given the antibiotic intramuscularly several times a day. The results were impressive. The temperature dropped, the pus disappeared, and the wounds began to heal. Cases that previously ended in amputation or death were now cured in a week or two. Penicillin saved hundreds of thousands of lives. Gas gangrene was the most dangerous complication of wounds. Clostridium bacteria entered the wound along with soil, multiplied in dead tissue, and released toxins and gas. The limb turned black, swelled, and emitted a foul odor. The infection spread at a rate of several centimeters per hour. The only salvation was urgent amputation. But even that did not always help. The toxins poisoned the body, and the wounded died of intoxication. Soviet doctors learned how to prevent gangrene. Careful surgical treatment of the wound with removal of all dead tissue, administration of anti-gangrene serum, and use of penicillin. This set of measures reduced the incidence of gangrene significantly. Another problem was tetanus. The tetanus bacillus lives in the soil, enters the wound, and produces a powerful toxin. It affects the nervous system, causing convulsions that break bones and stop breathing. The mortality rate from tetanus reached 100%. The only salvation was prevention. Every wounded soldier was given anti-tetanus serum. It contained antibodies that neutralized the toxin. Thanks to mandatory prevention, cases of tetanus in the Red Army were rare. Antibiotics and serums became the turning point that made it possible to defeat wound infections. While up to 60% of the wounded died from infections in World War I, this figure fell to 10–15% in World War II. The difference is enormous. Tens of thousands of soldiers who were doomed in the previous war survived this one and returned to duty. Science gave doctors a new weapon, and they used it with maximum effectiveness. But saving a life is only the beginning. How were soldiers returned to duty after severe injuries? Returning the wounded to duty was the main task of military medicine. It was not enough to save a life. It was necessary to restore combat capability. Fractures had to heal properly, muscles had to regain strength, and joint mobility had to return. Special hospitals for restorative treatment were created for this purpose. Here, the wounded spent weeks and months doing therapeutic exercises, receiving physical therapy, massage, and sanatorium treatment. The goal was to restore the functions of the damaged organ or limb as much as possible. Broken bones required prolonged immobilization. The limb was fixed with a plaster cast for a month or a month and a half. During this time, the bone healed. But the muscles atrophied, and the joint lost its mobility. After the cast was removed, rehabilitation began. Special exercises restored muscle strength. The movements started with simple ones and gradually became more complex. Physical therapy instructors worked with each wounded soldier individually, selecting the appropriate load. After 2 or 3 months, the soldier could move fully. Injuries involving nerve damage posed particular problems. Paralysis of a limb or loss of sensation rendered a soldier disabled. But nerves are capable of regenerating, albeit very slowly. Soviet surgeons developed methods for suturing damaged nerves and stimulating their regeneration. They used physical therapy, electrical stimulation, massage, and therapeutic baths. The process took months, but in many cases, function was restored. The paralysis receded, and the soldier could use his arm or leg again. Concussions and injuries with damage to the senses required a special approach. Deafness after concussion was often temporary. Hearing returned after weeks or months. Doctors used ear tube blowing, eardrum massage, and physical therapy. For eye injuries, they performed complex operations to restore vision. Many blinded soldiers partially regained their ability to see. Even those who remained disabled were trained in new professions so that they could be useful to the front and the country. Burns were treated for a long time and were painful. Extensive 2nd and 3rd degree burns required multiple dressings, skin grafts, and plastic surgery. The pain was constant, and healing was slow. But Soviet doctors achieved great results in the treatment of burns. The use of Vishnevsky ointment, early skin grafts, and infection prevention made it possible to save even those who had suffered burns covering 30 to 40% of their bodies. After recovery, many burn victims returned to duty. Nutrition played a huge role in recovery. The wounded received enhanced rations with increased protein, vitamins, and calories. Meat, fish, eggs, milk, vegetables, and fruit all helped the body to recover. Rear hospitals had real canteens with varied menus. Emaciated soldiers gained weight and regained their strength. Doctors understood that without proper nutrition, no treatment would be effective. Moral support was no less important. Hospitals had libraries, concerts were organized, and films were shown. The wounded wrote letters home and received news from their families. This kept their spirits up and gave them an incentive to recover. Many soldiers were eager to return to the front, wanting to take revenge on the enemy for their wounds. This motivation accelerated their recovery. Doctors said that wounded soldiers who wanted to return to duty recovered faster than those who had resigned themselves to disability. The results of the rehabilitation treatment exceeded all expectations. 72% of the wounded returned to duty after treatment. This meant that out of every 100 wounded soldiers, 72 became soldiers again. This indicator allowed the Red Army to replenish its losses and maintain its combat capability. Every soldier who returned to duty was valuable. But there were also those whose wounds were not visible to the eye. How were soldiers with psychological trauma helped? Concussion, shock from explosions, psychological trauma from what they had seen. All of this left invisible wounds. A soldier could be physically healthy, but mentally crippled. He was tormented by nightmares. He flinched at loud noises. He couldn't sleep. He lost his ability to concentrate. In World War I, such soldiers were called malingerers and punished. But Soviet doctors understood that this was an illness that needed to be treated. Special wards were set up in hospitals to help those suffering from concussion and psychological trauma. Concussion from a nearby explosion affected the nervous system. The shock wave affected the brain, causing concussion or contusion. The soldier lost consciousness, then regained consciousness, but could not speak, hear, or move. Sometimes paralysis of the limbs developed, although they were not physically damaged. This is called functional paralysis. The nervous system blocked movement. Treatment required patience. Doctors used physical therapy, massage, hypnosis, and psychotherapeutic conversations. Gradually, functions were restored. Loss of speech after concussion was a common occurrence. The soldier would open his mouth, but could not utter a word. This was called functional mutism. The vocal cords were intact, but the brain could not control them. Treatment took weeks. Speech therapists worked with the concussed, teaching them to pronounce sounds, syllables, and words again. Hypnosis was often used. During the session, the patient began to speak. This showed that the ability had not been lost. It just needed to be unlocked. Most of the shell-shocked soldiers regained their speech. Psychological trauma was more difficult to treat. Soldiers who had gone through the hell of battle, seen their comrades die, and lost friends accumulated enormous stress. Some developed neuroses, depression, and post-traumatic stress disorder. They became irritable, aggressive, or, conversely, apathetic. They suffered from insomnia and nightmares. They could not return to normal life. Such soldiers were referred to psychiatrists and psychologists. Conversations, group therapy, and occupational therapy were conducted. The main thing was to make them understand that they were not alone, that others had gone through the same thing. Special attention was paid to soldiers who had been captured and escaped. Captivity was a terrible ordeal. Hunger, abuse, and humiliation broke their spirits. Liberated or escaped prisoners were checked by the NKVD, then sent to special camps. There, doctors worked with them to restore their physical and mental health. Many returned to duty after rehabilitation, but the psychological scars remained for life. Doctors understood that the best treatment for psychological trauma was a return to normal life. Therefore, an atmosphere as close to peaceful as possible was created in hospitals. Concerts, movies, sports competitions, and socializing with comrades all served as distractions from painful memories. The wounded engaged in their favorite activities, read, wrote letters, and crafted things. Many began to learn new professions, preparing for post-war life. This gave them hope, purpose, and meaning. Families played a huge role in psychological rehabilitation. Letters from loved ones were the best medicine. News from home, a photo of a wife and children, a few lines from a mother. These things lifted the spirits more than any medicine. Some wounded soldiers were allowed short-term leave to go home. A few days with their families restored their will to live and fight. The soldier understood. His family was waiting for him at home, and for their sake, he had to recover and return. Not everyone was able to cope with psychological trauma. Some soldiers remained disabled due to their mental state. They were discharged, sent home, or to special institutions. But the percentage of such cases was small. Most of those who were concussed and psychologically traumatized recovered and returned to duty or to peaceful life. What specific figures were behind the success of Soviet military medicine? And how did this affect the course of the war? Numbers are the dry language of statistics, but behind each number are human lives. During the Great Patriotic War, Soviet military medicine treated more than 22 million wounded and sick people. This is a colossal number. 22 million people passed through the hands of military doctors. Of these, more than 17 million were returned to duty. 17 million soldiers who took up arms again and continued the fight. This is the very 72.5% that historians talk about. But an even more impressive figure is that 90% of all the wounded ultimately survived. Only 10% died from their wounds or their consequences. In World War I, the figure was the opposite. Up to 70% died. The progress is obvious. If Soviet medicine had been at the level of 1914, the losses would have been several times greater. The Red Army would not have been able to replenish its personnel losses. The war could have ended differently. Let's look at specific types of injuries. In the case of gunshot wounds to the limbs, 85% of the wounded returned to duty. In the case of chest wounds, 60%. In the case of abdominal wounds, 55%. In the case of traumatic brain injuries, 40%. Even with the most severe injuries, almost half of the wounded survived, and many returned to combat. It was a triumph of medical science and the skill of military doctors. Limb amputations were sharply reduced. In World War I, 1 in 3 wounded soldiers had a limb amputated. In the Great Patriotic War, it was only 1 in 10. Vishnevsky ointment, penicillin, and proper surgical treatment of wounds saved hundreds of thousands of arms and legs. This meant that hundreds of thousands of soldiers avoided disability. They returned to service as full-fledged soldiers, and after the war, as full-fledged members of society. Mortality from wound infections fell from 60 to 15%. This was a direct result of the use of antibiotics and sulfonylamides. Sepsis, gas gangrene, and tetanus were no longer a death sentence. Thousands of soldiers who would have died from infection in the previous war survived this one thanks to penicillin. Every soldier saved was an additional soldier on the front line and an additional worker in the rear after the war. The time from injury to qualified medical care was reduced threefold. In World War I, the wounded waited a day or even 2 for a surgeon's help. In the Great Patriotic War, it was 6 to 8 hours. This saved them from shock and blood loss. The faster the wounded got to the operating table, the higher their chances were. The system of staged treatment worked like clockwork. Each link performed its function quickly and precisely. In total, more than 10 million operations were performed during the war. 10 million. This means that every second wounded soldier underwent surgery. Soviet surgeons worked with incredible intensity. During major battles, one surgeon performed 10 to 15 operations a day. Over the years of the war, some doctors performed several thousand operations. Their hands saved tens of thousands of lives. The medical service also suffered its own losses. More than 85,000 military medics died during the war. Doctors, nurses, and orderlies died under bombs, from sniper bullets, and in captivity. They paid with their lives to save others. Their feat cannot be overestimated. Thanks to them, millions of soldiers remained alive. These figures speak louder than any words. They show that Soviet military medicine achieved results that seemed impossible. It saved more lives than the army lost in battle. It restored the army to a strength equal to that which entered the war. Without this, victory would have been unattainable. But what legacy did military medicine leave to post-war science and practice? Victory was not only won on the battlefields, it was also won in operating rooms and hospital wards. Military medicine made an invaluable contribution to the defeat of the enemy. But its significance was not limited to the war years. The experience gained by doctors on the front lines formed the basis of post-war medical science. The techniques developed by Burdenko, Vishnevsky, and their colleagues became the standard for peacetime surgery. A whole generation of doctors went through the school of war and brought their knowledge to peacetime life. Neurosurgery made a huge leap forward after the war. Burdenko's methods for treating traumatic brain injuries began to be used for peacetime injuries, brain tumors, and vascular diseases. Thousands of people who had previously been doomed were given a chance at recovery. Burdenko's students created a school of Soviet neurosurgery, which became one of the best in the world. Institutes, clinics, departments, all of this grew out of the experience of the war years. Vishnevsky's methods of local anesthesia became firmly established in practice. Novocaine blockade began to be used not only in surgery, but also in therapy, for the treatment of pain syndromes, inflammatory diseases, and injuries. Vishnevsky's ointment is still produced and used today. It is as effective as it was 70 years ago. Its simplicity and accessibility make it indispensable in outpatient practice, rural medicine, and extreme conditions. The experience of mass treatment of the wounded laid the foundations for modern traumatology. Methods of osteosynthesis, the connection of bone fragments with metal structures, methods of reconstructive surgery of the limbs, principles of rehabilitation. All this was developed during the war years. After the war, specialized trauma centers, prosthetics institutes, and rehabilitation clinics appeared. War invalids were the first to receive modern prostheses and the opportunity to return to an active life. The blood service, created during the war, continued to operate in peacetime. Blood transfusion stations opened throughout the country. Donation became a mass movement. Stocks of blood and its components made it possible to save lives in accidents, operations, and childbirth. Blood preservation methods were improved. New blood substitutes and blood products appeared. All this grew out of wartime experience. Antibiotics revolutionized medicine. After the war, their production increased thousands of times over. Penicillin became available to everyone. Infections that were previously fatal could now be treated in a matter of days. New antibiotics appeared: streptomycin, tetracycline, and levomycetin. They defeated tuberculosis, pneumonia, and meningitis. Mortality from infectious diseases fell tenfold. This is a direct legacy of military medicine. The organization of medical care in mass disasters is based on the principles of military medicine. Triage of victims, staged treatment, rapid evacuation, all of this is applied in earthquakes, accidents, and man-made disasters. The Disaster Medicine Service was created on the model of the military medical service. The experience of war teaches us that in the event of mass casualties, it is not only the qualifications of doctors that are important, but also the organization of assistance. A generation of military doctors raised the next generations of medics. Burdenko, Vishnevsky, and their students created medical schools that shaped the development of Soviet and Russian medicine for decades. Their textbooks, monographs, and scientific works have become classics. Their methods are studied by medical students. Their experience is passed down from generation to generation. The memory of military medics lives on. Monuments to doctors and nurses stand in many cities. Military medicine museums preserve instruments, documents, and photographs. Veteran medics met with students until their last days, telling them about the war and passing on the baton. Their feat is not only the lives they saved during the war, it is also the foundation on which modern medicine stands. The war is over, but the struggle for life continues every day. In operating rooms, intensive care units, and emergency rooms, doctors save people using knowledge and methods born in the heat of war. Every life saved is a victory over disease, injury, and death. And this victory is thanks to the contribution of those who, in 1941-1945, operated on the wounded, carried them from the battlefield, and nursed them in hospitals amid the roar of cannon fire. Their legacy is immortal.